The health department has reported a notable increase in COVID-19 cases nationwide. Let's get some more details from JC Cosico, who's joining us live from Quezon City. JC, good afternoon. What does this notable increase mean in a numerical context, and is this already a cause for concern?
Sean, the country was able to record 400 infections daily in the recent week, which was said to be the same rate back in February. And now the health department said that despite the increase in cases, the Philippines remains to be at low risk for COVID-19, as the average daily attack rate remains to be at less than 1, with the country's positivity rate at 3.1%. And this increase is not yet translating to higher severe and critical cases, including that of admissions. Now the DOH encourages vigilance among the public and for them to follow health protocols and to receive booster shots to control the spread of this virus. Sean.
Right now, which regions in the country are actually seeing a significant increase in infections at the moment, JC?
Sean, DOH Chief Maria Rosario Vergara said that Metro Manila is currently experiencing a significant increase in COVID-19 infections. Now, the positivity rate of the region is at 4.4%, and this increase was recorded since mid-May with at least 200 cases per day in the recent week. Sean.
All right, so the DOH likewise reported new cases of Omicron subvariants being detected here in the country. Do we know more about this, JC?
Sean, the Philippines detects 32 more cases of the Omicron subvariant BA.5. Total now at 43. Now these new cases, majority of these are from Region 6, are fully vaxxed and with mild symptoms. Now exposure remains to be unknown as their travel histories are still being verified. Of these number, 16 have recovered, 14 are undergoing isolation, and 2 are being verified. Now the DOH said that they can't establish yet whether there is a community transmission of the Omicron subvariants, as more evidence is needed, and the DOH said that these cases can still be linked to each other. Sean.
All right, and as cases rise, JC, are we noticing an equal rise or a proportionate rise in vaccinations? And when can we expect the booster rollout for the 12 to 17 age group?
Sean, the vaccination or the additional dose vaccination for 12 to 17 years old, particularly for those who are immunocompromised, has just started today, while the DOH targets to begin the rollout for the rest of the population for the said age group either on Friday or Saturday. Now, but there is a different interval between the two, 5 months for non-immunocompromised and 28 days for those who are immunocompromised. Now, the DOH says there is a total of 9.4 billion 12 to 17 years old who are fully jabbed, while there are over 200,000 who are said to be immunocompromised. Sean.
Right, well, it's not only COVID cases that are on the rise. Dengue cases are likewise also shooting up. How are we doing on dengue? What's our status?
Sean, as we speak, according to Yusek Vergara, from January 1 to June 4, dengue cases in the Philippines have reached over 39,000, which was said to be 31% higher from the cases from last year. Now, the DOH said that majority of these cases were from regions 3, 7, and 9, and 14 out of the 17 regions of the country also had increasing trend in terms of cases, as they have exceeded their epidemic threshold in the past 4 weeks. Now, since January, there are over 202 dengue deaths. That's why they are appealing to the public to continue following the 4S strategy to control the spread of dengue. Sean.
Thank you so much for that update. JC Cosico joining us live from Quezon City.